Hi, it's Barry Neal here. I'd like to invite you to my next masterclass webinar, and this is on the subject of parts conflicts. Now, if you're a therapist, you're going to come across situations pretty much on a regular basis where your clients are going to have some form of parts conflicts. These are extremely common if you work with things like weight loss or addictions and things like that, because there is one part of them that wants to do one thing and one part of them that wants to do something else. And as a therapist, you really need to learn how to work with this incongruence. And there are two ways of working, because there are two types of parts conflicts. There are first parts conflicts are what they call simultaneous incongruities. Now this is where the parts conflict happens at one time. So it's like on one hand, I want to do this, but then on the other hand, I want to do that. So for example, it might be, I really want to lose some weight, but I want to have a curry. Or I really need to save some money, but I'm going to go shopping this weekend. There's both, the conflict is happening in the here and now. They're both there present at the same time. And there's a totally different way to work with this type of parts conflict than there is when you work with the other parts conflict, which is called a sequential parts conflict. This is where, and often this happens with addictions, where the client will make an appointment. Let's say they're an alcoholic, for example, and they come in and you talk to the client, and what you're talking to is the sober part of them. This is the part that really wants to change. And if you do therapy with this part, chances are it's not going to have any long-term effects, because you're already working with the part of them that wants to stop doing that behavior. The other part, the drunk part or the drug part, is not even there. So with a sequential incongruity, it's almost like some form of multiple personality at the extreme end. I mean, it's not as bad as that because there is communication, but it's like there is the sober part and then there's the drunk part, and they don't meet. And so you need to have a way, if you're working with this type of client, to bring both of those parts in the room at the same time and integrate them. And so as we go through the webinar, I'm going to be looking at techniques that work with the simultaneous parts incongruity and the sequential parts incongruity, and then to integrate them. A lot of the parts models that you'll see out there, particularly in hypnosis, they have the person hypnotized, they call out this part, and they start communicating with this part. Sometimes they even name the part, which is a big no, don't do that, because what you're doing is you're actually installing it, and you're giving then the client an excuse. You're increasing the incongruence in the client and in the part. So whenever you do any really effective parts work, you need to integrate them. You need to integrate the part with the whole. The less parts a person has, the better they will be. So whatever technique you use, you should always, at the end of the process, integrate it into the whole. So this is what we're going to be looking at in this webinar. We can look at the different types of parts conflict, the sequential and the simultaneous ones, and look at the techniques that work with each and how we're going to do it. So we're going to learn two really powerful techniques that come predominantly from the work of NLP, and you'll be able to use straight away, so that when the webinar is over, you'll be able to go back on the following day and use them with your next client and have great success. So if you really want to learn how to be far more effective with your clients, particularly those ones who have parts conflict, sign up now for the webinar. It will sell out really quickly. All the other ones have sold out virtually within a couple of days. So if you do want to do it, please let me know, sign up straight away, and I'll see you on the webinar. And I look forward to hearing from you then.